going to change the game for young patients dealing with arthritis. And this really affects all of us. We all know someone burdened with arthritis. There are over 30 million adults in the US commonly suffering from the most common form, which is osteoarthritis, but they're a lot younger than you think. 60% are between the ages of 18 and 64. Now we can stratify this a little bit further if we just look at hip disease, and we know that there are over 1 million patients under the age of 65 with chronic hip pain due to osteoarthritis. And yet, only 20% of this patient population will proceed to a total joint replacement at that young age. That means 80% will choose to live with chronic pain and disability for two reasons. One, they want to avoid restrictions on high-impact activities now, and they fear high revision rates for their future selves and what that means for their quality of life. And this equates to a $5 billion total US market opportunity by 2030. So our new hip is a solution for this active patient. Instead of replacing the entire joint with metals and plastics that are supposed to be permanent, we're just dealing with the damaged areas in the joint. Our implant restores the form and the contours of the joint, as you can see here, but then it restores the joint mechanically, as you can see from this animation. We designed it from the ground up to get these patients back to their active lifestyle from day one. And then after 24 months, the implant is slowly absorbed and replaced by functional tissue. And we think this is the only solution this patient will need. Now we call this a smart osteoarthritis fix because whenever you have inflammation in the joint caused by arthritis, that causes degeneration and that causes deformation of those joint surfaces. And in order to be successful, we need to restore those joints back to their native architecture, and that's what our implant does, as you can see in this image. And the timeline to restoration is pretty fast. We showed in our animal trials before we got IDE approval that within 3 months, the animals with renewed hip were behaving perfectly normally and were restored to full functionality, and that's compared to the osteoarthritis control. So mobility, motion, and pain-free function were restored. So we've got a lot of traction. We've raised over $18 million in non-dilutive funding. This year we'll surpass $22 million in non-dilutive funding. We're published. We have breakthrough device designation and incredible validation from the world's largest orthopedic society, the American Academy of Orthopedic Surgeons, having won their highest award in 2021. So here's our team. I started my career at Medtronic. Farsh is world known for his work in regenerative medicine, and Frank is our textiles expert, and this was started when we were at Duke University. We have an incredible team of advisors who actually wrote the book on hip preservation, and they're helping guide our development efforts, and then an incredible business team who cut their teeth at the major medical device strategics. So I love this team, and it's one that's poised for success. Our timeline looks like this. We have an IDE study approved. We're raising a $3 million bridge round to get us through that first clinical trial. We have a few years of clinical trials ahead of us and some pipeline development to do, and our opportunities for exit really scale with the quantity and the quality of that clinical data. I'm Brad Estes, and I look forward to speaking with you more today.